I'm here in the prayer garden at the hospital, a Village of Hope, and it's been a long time since we've checked in, just feeling the need to update everybody on what's going on here in Kenya. It's been an eventful couple of months worldwide. I think this is one of the first times that we're all really in a same situation together everywhere in the world. We're all facing fears, we're all facing challenges, there's frustrations, a lot of people out of work worldwide, and I think we can all say that this has been a challenging start to 2020. And yet we know that we have such a faithful God even in the midst of these challenges. Here in Kenya, we do see our COVID-19 numbers coming up right now. We have over 1,200 documented cases in the country, and each day the numbers are rising. Thankfully, in our county right now, we only have 5 documented cases in the county, but with the numbers coming up, we're not sure where that's going. So we do have our staff ready. We've done training. We have triage processes in place, and thanks to a lot of generous donations, we have been able to get appropriate PPE, so we know that our staff are safe in providing care here in Kenya. We also are dealing with food insecurity and flooding that has been going on. We've had people praying, and thankfully we've gotten a little bit of break from the rain recently, but we've dealt with some pretty heavy floods here in Kenya. And we've had neighbors that have been displaced because of flooding. We've had farms that have washed out because of flooding. And with the current global economic situation, we're looking at food insecurity in the coming months. So it's a lot of heavy burdens here right now. And with those heavy burdens, we are so thankful to be an organization that focuses on hope and the fact that we do have hope no matter what the situation is. And we are continuing to show up at the hospital and to show up at the outpatient clinics and provide care and meet patients in the place where they are at. We have chaplains that are able to meet with our patients and pray with them. Patients are still getting sick. We still have people with critical situations that come in. Babies are still being born. We've had 3 babies born just in the last few weeks at our Chibaywa clinic, which has been a real joy to be a part of. And we are right on the cusp of opening the 24-hour service at the hospital. So we are getting ready to, on June 1st, provide 24-hour urgent care and get our maternity wing open. So those are pretty exciting new steps for us. And we really covet your prayers as we are in a time of a lot of uncertainty, but also certainty of knowing that we have a great God who brings great hope. So we do ask that you stand with us in prayer. We want to thank you for your ongoing support. We are looking to organize a day of fasting and prayer for Kenya and for specifically the Ministry of Hope Matters coming up. So we're going to put together a prayer guide and information for how you can be praying for us. If you'd like to be a part of that, please send us an email and let us know. We can get that prayer guide and the date that we're looking at doing this day of fasting and prayer out to you. But we do appreciate whether you're willing to do a whole day of fasting and prayer, or if you just want to get the prayer guide to be walking with us over the next couple months and knowing how to pray. That would be fabulous. We appreciate each one of you so much. I can't tell you what an encouragement it is to me to see the donations that continue to come in. I know so many of them sacrificially. We feel your prayers, we appreciate your encouragement, and we want you to know that we are praying for you too, and that we are in this together. And we are so thankful that we serve a God who has a hope that does not spoil, it does not fade, and it does not disappoint us. And we know that that eternal hope is here with us. So thank you for continuing to stand with us, and we will continue to keep you posted. Thanks.